for those of you that don't know me, I'm Katie Lands. I've been in the industry about 25 years. I'm obsessed with this stuff. I spend pretty much a majority of my time thinking about where is the hockey puck going. And along the way, I make some great friends because I think that's what they care about too. And so that's what we're going to talk about today. You'll see here, if you don't know them already, I'm pretty much everybody knows who's up here, but Bill to my right, he's been with us, gosh, over 40 years, right? Or longer in this industry.
40 years.
And we mostly know him because he was the CEO of the National Home Care and Hospice, NOC, which is the now newly formed alliance. But he's got a new transition, and he's gone into counsel again in healthcare practice and home health and hospice at the law firm Arnold, Golden, and Gregory. And I think this is actually a great time because you can reflect back on what I love about Bill is that there is some history repeating itself in what we're seeing today, but also that lens from the legal and policy side, which I love so much. And then we have Dr. Landers down on the end, who has had a couple decades experience as an MD exec and a public health policy expert. One thing that we both have in common, we're both geriatric and palliative board certified.
Yeah.
And I'm really proud of that.
We're going to have to take on these two attorneys here. We got,
No, we're clinicians.
We'll take those odds.
But we've been at the bedside, and with all the innovation that's happening so quickly, just to sniff out, is it going to work, and where the puck is going? Will people do it? Will people show up? He is now the CEO of the newly formed National Alliance, and I'm really excited to see what you've been up to these first few months, and also what that means for where we're headed. And then finally, which I love to round out the group, Angelo Spinola here to my left. He is the shareholder and practice chair of both home health, home care, and hospice at Polsinelli. And he focuses on employment litigation and compliance. He does a lot of support with M&A as well, but he has a special interest in our industry. And if you know him, he shows up, and he's just a good, honorable human who will talk through the what-ifs of life. And so let's just dive right in and get to talking. We have a little bit more condensed time. I think we're running over just a bit, but we do want to leave a little bit of time for questions, so please don't, write them down, and if we don't get to answer them here, we will. Just come find us afterwards, and we can talk about it. I am going to, there is a great slide that came recently from Home Care Homebase and Symmetry. If you're here in the audience, raise your hand, thank them. They highlighted some of the changes that are happening in the market, and I can't see them. Unfortunately, we might need to make this bigger for me. I can see up, hey, boom, thank you. But it's just a great snapshot of the industry changes that are happening so rapidly to us and around us. In home health, we know that there's market consolidation, the growing volumes of people who have demand for services, clinician shortages across the board. You guys know all this. We do have some Medicare rate neutrality and inadequate MA rates. I won't read again, but this is all changing rapidly. And the administrative burden and the entrance of AI is just fast tracking. It's hard to stay alive in the industry. We are seeing in the home health industry there are less agencies, and that is, yes, because of some M&A activity, but it's also because there are new entrants, and what we are seeing is substitution competition potentially, or the offloading of services that look a little bit different. In hospice, the same thing. I was part of a substitution competition with Aspire, and you'll see that palliative care expansion. There are lots of policy changes coming. There are quality initiatives through HOPE coming for patient-driven consumer outcomes that will change the way we look at quality. And there's regulatory scrutiny and administrative burdens that we all know that, all too well. And then finally, personal care. Do we have personal care representatives there in the house today? Yes, and I'm so glad that you're here. I think often we speak around you and not to you, but we also are seeing lots of the caregiver churn and the new rules and the Medicaid reductions and the private pay. So this is a great slide that highlights the changes, and it doesn't even touch on the tech and the AI and the things that we're seeing, along with the market changes, which we're going to discuss. Finally, there are three things decreasing, and we are only going to highlight one here, but the number, and this is just Medicare, but the number of Medicare beneficiaries using home health services Also, the level of those services and agency numbers are all three declining. Why is that? What is that? Especially when the demand is up for people. And then I want to think in the eye of the payer, this other market trend, and then we're going to get to the brilliant minds around me. How are Medicare Advantage companies looking at this? Is a slide from a colleague of mine who works with CenterWell, and the way that Humana is looking at it with this culture wraparound, technology, and then the insurance services on the left, which is huge volumes of people. We know that Medicare Advantage penetration is going up in America, and how they're thinking about owning human services within their organizations, how they're thinking about value-based primary care, which they want to own as much a part of, home health, and then also the pharmacy and health equity. So we are seeing more and more M&A activity in those areas. We are seeing, I think that might be the reason for some of the changes and the decreases, but we're going to talk to them, see what they think too. And one thing I want to start off with is this idea of what's happening in DC right now and the powers that be there. Who are they? What are they thinking about? And what are we seeing for those that are out there actively discussing with the people on the Hill? I personally have worked for the people, specifically in the DOGE and specifically at CMMI. And I'm talking, just the head honchos in these areas. And there is a lot of deconstruction for reconstruction, especially with DOGE. The other Doge. And I think they also own, the elephant in the room is that they own some assets. The individuals making a lot of the decisions potentially own human service assets. They might actually have at-risk organizations that they might be trying, to support and protect. And that tells a story for us. And when we think about strategy and how we're going to make our decisions. So I'm going to start with you, Steve, if that's all right, because you are
Sure.
on the Hill. How do you think, you're deeply involved in advocacy and public policy. But what are you seeing in the first few months in the new administration and Congress and the implications for the future for us?
Thanks, Katie. I mean, the context for us, I think, is really important to start with, which is that everyone here is part of a transformative movement, a potentially transformative movement in American healthcare, right? We have an aging nation. We have to plan for this. We have overrun costs in many of our public programs. We need to keep people healthy at home, avoid unnecessary hospitalization, institutionalization. So this is a strategic, we have a strategic resource, tool, really a national treasure to help solve some of these problems in this room. And just like AI is transformative, care at home is transformative. And so we come into this environment, we have a new Congress, we have a new president, sort of, right? We've had President Trump before. And there's been a lot of change already. We've had 20,000 people through the DOGE initiatives let go in Health and Human Services Department. We already passed a continuing resolution which had some health-related pieces in it. We're right now in the middle of this reconciliation conversation where a lot of Medicaid policy appears to be on the line. And I think the themes, and it's fast-paced, and there's some things that we don't know yet because it has to come into say, but the themes of the new Congress and new administration are things around ending waste, fraud, and abuse, around making these programs more efficient and sustainable for the long haul in terms of Medicare and Medicaid, addressing things like more value-based care and risk-based care and things like site neutrality payments. So on one hand, what we have in front of us are huge opportunities, right? We have opportunities from an advocacy standpoint to address some regulations that get in the way of the things that we do, because there's an audience that's interested in deregulation. We have an audience that wants to see cost of care come down, and we've got care at home providers who can, whether it's medically based or socially based. I mean, I've been impressed how often a home health aide has much bigger impact on human health than physicians like myself. And so we've got this potential partner in care delivery and value-based care. And on the other hand, we could see some policies that could be very hard and potentially toxic to care at home. The idea of quickly, without testing and safeguards, carving in our treasured hospice program into Medicare Advantage without the legwork needed and the preparation needed in a way that just discounts it and limits care. We could see faster pace of the Medicare cuts that have already certainly kept reimbursement below labor cost inflation. It led to tens of millions of home health visits being taken out of the system, and access to care is going down, not up in the home health world. So I think there's a lot at stake. I think that advocacy and our work together is what's going to play some sort of role in this. Remember, and one of the things I'm learning in Washington, I'm going to end on this because I know it's painful for you to hear me talk this long, is that I know this from my kids and wife. They tell me every day. The thing I'm noticing that I'm spending more time in Washington, okay, in Capitol Hill, and my mentor and friend Bill knows this well. You go to do a house visit, okay, at the Capitol Hill, or to go to the White House and make a visit, okay? It's like the line for Space Mountain at Disney World, all right? Everybody and their brother is trying to influence what's happening. And if you just do a quick look, do a data dive on Open Secrets or something, there are individual companies and other segments of healthcare and social policy that just the individual companies are spending more on lobbying and campaign contributions than our entire industry, all the associations in our industry and all the companies in our sector combined. So the good news is often right beats might, and we've got a story to tell and we create value. And the bad news is we're gonna have to stick together and be loud to make sure we get the best out of this environment and that we realize those opportunities and avoid some of the real risks, because there are a lot of things that could go wrong.
I love your passion, and we're glad you're in the seat to carry it. And I think you're hitting on that coalescing too, and how the opportunity to potentially come together, through the alliance. And so, Bill, looking back at your work, and now with the new lens that you have, kind of from the outside in, what are your feelings about the influences and where they're taking us?
I think we're winning the battle.
Yeah.
And I mean, you don't win a battle alone, you have to win the war. I think we're in a war at this point, but we are so far ahead with the concept that healthcare at home is a priority. It is the #1 choice. It's there. We have setbacks through all of that, but we have Republican support, we have Democrat support and the like, but I'm in this kind of quasi-retirement mindset at this stage, and I'm looking at Jennifer Sheets, and she kind of gave me a suggestion of what I should be doing instead of sitting up on stage. She and Dave Totaro sitting next to her. As part of a retirement gift, they gave me a book on opening up a hot dog stand. I'd still prefer to work in home care than a hot dog stand. I'd rather be a customer at the hot dog stand, perhaps that way. But I'm still quite heartened by where things are. But the main thing that I learned in Washington, for all those years, the decades that I worked alongside of Steve and members like yourself, in terms of the advocacy efforts, is that Congress and administration and health policy people and health people can love healthcare at home. I mean, literally love it. But then you've got the second phase of that, paying for it. And that's when things change, the mindset changes. We're in a Washington time right now, not the first time this has ever happened, where money matters a lot.
Yeah.
And that creates some pressure, some tension that's there. But if I had a choice to say who's going to win the battle relative to money in healthcare, well, somebody may look at the doctors and their power, somebody may look at the hospitals and their power, but there's only one dimension of healthcare at home that routinely has an ROI, and that's healthcare in the home setting. The case can be made continually. It needs to be made continually by all of you there. This is not a Pollyannish look on things. I mean, folks, this is right now Medicaid, for example, facing nearly $800 billion in cuts. And one of the biggest costs within Medicaid is home and community-based services. The state of California, the last time there was a issue of Medicaid cuts that were not home and community-based, cut home and community-based services in California. It's an optional program along the way. So while I look at this in a positive way, while I'm now seeing those hot dogs on the grill and they look really tasty, I'm also looking at the need to arm ourselves, for this battle, for this war that's there, one that I truly believe we can win. But it's not going to happen with Steve or Bill or Angelo or you, Katie, alone. It's going to happen with the people in this room and thousands more besides that. But when you really look at the economics and you look at the patient and public interest in care at home, how could you not be thinking positive?
Yeah, and the product is our people who do this work, and telling that story is going to be huge. And Angelo, you have such an important, unique lens. You get to see inside many of the companies that you work with, and we discuss the market influences, the new political climate, and the shifting of risk and the economics. But how's this impacting the market that you work with and the companies that you support?
Yeah, so my lens is really representing a lot of the providers in the room, and I can tell you I agree with everything that Bill and Steve have said about the long-term outlook. And I think it's rosy. I think we're in a good position. But I can say from the provider perspective, there are a lot of nerves, a lot of concern. We have gotten more calls than I can remember worrying about the $880 billion and where that's coming from. That's not coming from fraud and abuse, right? You're not going to get there on that. So a lot of concern. We're seeing a lot of payer diversification, particularly from the larger shops, right? Looking to not have other eggs in one basket, trying to figure out, if the government zigs, how do we zag? It's a long process. You can't just change what you're doing, but we see a lot of that. To Steve's point, a ton of advocacy, and I think one of the strongest things that we've got is our voice, right? When there's a lot of coordination now within the industry, I think to some extent there always has been, but especially now, and we might not have the biggest paycheck, but when we are singing together, it is loud. So that's been awesome to see. And like Steve said, a lot of people on the Hill. I think the focus really has been a lot on education, just trying to make sure everybody understands what is home health versus home care versus hospice. That's still a conversation, still an issue. And then the last point I'll make, when we're talking about payer diversification, some of the changes in the regulations, some of the unique models that we're seeing, the family structured caregiving, self-directed. We're seeing providers that have traditionally engaged in sort of one way of running a model, really exploring and looking at some of these alternative models that bring the overall cost of care down to try to increase margins on the reimbursements.
Yeah, well said. And in my work, I'm often called to think about what are the new products we should be considering and weighing that with the tensions of the market today. But building, I say, like, we have to build around human need as well, and what people, that you guys just talked about this, what people in their homes need. And it might not look like what we do, but how do we utilize the people who are already there and position it as products that we can go and use out in the market and sell differently to diversify and protect ourselves. So Bill, you are seeing a lot of partnerships through the years that have formed to give that momentum, yes, on the Hill, but also to sustain our industry. What are some of the success stories that you're seeing or have seen and are following that are working well?
And I think that's one of the blessings of care in the home, is that there are willing partners out there, and family members certainly are among them, if not the most important partner that's there. But what we're seeing is success in partnerships with hospitals, joint ventures in particular, rural areas being unstable from a healthcare perspective, being strengthened by the partnerships that involve care in the home setting. We're seeing partnerships with ACOs. Most ACOs are running with physician-driven kind of an approach on that. And you're seeing actually the greatest growth in value-based approach and risk sharing is in ACOs over Medicare Advantage and Medicaid managed care as well too. But ACOs with home care people at the table, and that doesn't just simply mean sitting at the table, it means coming prepared, bringing the data, bringing the logic that's there, making people aware of things that may be there. We're starting to see the emergence of special needs plan approaches in healthcare. The nursing homes have already been there for a bit. Home care is looking at it and getting more involved in it too. And when you're looking at Medicare Advantage, special needs plans is the greatest growth segment within Medicare Advantage and the variety of plans that they may have there. And probably the most important beyond family, is the partnerships coming with physicians. And the common denominator is, well, physicians, practitioners, maybe in a broader sense that way, having greater and greater connections as partners in the matter that's there. That one's been one of the most difficult, because how do you monetize it for the parties who are participating in it? They're not necessarily sharing risk unless it's an ACO kind of a model along the way. But there's a lot of indication out there that you will have a significant chance at these partnerships, but you probably have to be the one who initiates the effort rather than being responsive to it. It's not like the hospitals are calling home care companies and saying, hey, why don't you come in and sit with us? They are actually starting to do that with the team programs and stuff like that, and now the expansion of some of the special diagnoses, bundled payment kinds of approaches. But if you're waiting for that call, you probably will be waiting a long time. Networking with people, coming to a golf course like at Silverado and playing golf with a bunch of hospital executives might be a thing to do. Although the ones I saw on the golf course from my window, no.
But you hit on something that is the way that decisions are made, and currently the demonstrations that are occurring in CMMI, they have to look at billing, they have to look at coding, they have to look at places of service. That's how they define a lot of these models. So I think it is a really important strategy that we're going to talk about strategies in a little bit, to align yourself with those groups that they can follow and tell the story together as partnerships. And Angelo, a lot of people here are struggling with like these dated MA deals and less than average reimbursement rates and draconian rules and regs. What are you seeing some of the people that you work with do to rewrite that script and be successful, or rethink, retool?
Yeah, it's a challenging thing because, and I'll wear the big bad lawyer hat here for a minute.
Somebody has to.
Because you want to negotiate. Empath, for example, they're my new hero. Negotiated with United for several years and then just canceled the contract. Right? They couldn't get what they wanted by in connection with their rates. Canceled the contract, and then United came back to the table and gave them I think generally the rates that they were looking for. But not everybody can do that. I think for the smaller providers, that's really hard. You have to have a lever that you can pull. And what we have seen, and I'm all for advocacy. I think we've got to try. And I'm thinking here maybe a little more on the government payor perspective. We're seeing providers, and hopefully nobody's in here from the DOJ, thinking about this from an antitrust perspective, but providers working together where maybe an individual voice isn't loud enough, working together. And these are providers that are like-minded, that maybe are in the same program, doing some things to be a little more aggressive, whether that's litigation or a threat of litigation, but to do a little more to increase rates when we're not seeing increases, right, through the advocacy perspective. So that I think is an area where there's been a lot of activity. I think we'll see that over the next several years.
Yeah, I agree. It's an area where we will win together, but we have to tell the story the right way and economize it as well. And Steve, the value demonstration is so much of a part of your work that you did prior to coming into this role, along with the policy. As clinicians, it's always been the story of how do we demonstrate our value as palliativists and clinical care. But when you think about the investments that the people here are needing to make to create and demonstrate that value, tell that story, find one another, what are you seeing emerging in the landscape today?
I mean, I see a lot of incredible work being done, and that either in Washington or dealing with these monoliths that the negotiation is so asymmetric, they don't move forward. I mean, one of the reasons that I wanted to be in this role, be careful what you wish for, by the way, folks, is because you work years on a Medicare Choices Model demonstration or community-based care transitions, or you launch a home-based primary care program with an ACO REACH model, and you help older people that are very seriously ill stay home towards the end of life and get the cost low, but then you don't see the system move forward in the way to accommodate more of those really good things. A few weeks ago, Warren Buffett, he gave his last address as the CEO, or the last shareholder meeting as the CEO of Berkshire Hathaway. And one of the questions he got, I think it was from like a high school student. You couldn't make this up. I mean, I'll remember this the rest of my life. And she says, well, Mr. Buffett, why did you, Jeff Bezos, and Jamie Dimon give up on your effort to transform healthcare? Okay? So those are three pretty big, influential, well-resourced companies in America. And Buffett says, he said, the tapeworm is too strong and powerful. He said the only way that this 20% of our economy, industry that's totally intertwined, and all the things I talked about earlier in our society, the only thing that's going to change it are the 435 people in Washington. We can't do it from Main Street alone. So I think that we have to see. I would say absolutely keep people healthy at home. Caregiving, we're all about caregivers. If you have ways to embrace caregivers, get more caregivers into the workforce, keep them happy, having them spread love and compassion and productive, and they're doing less dumb stuff because AI and logistics software are helping, and their managers treat them right. Any of those things, those are going to work. Any models that uses analytics paired with tender, loving care to help keep people healthy at home. And it's not just medical stuff, by the way. How many times do you see just the unmet social needs or basic caregiving supports can save hundreds of thousands of dollars in hospitalizations, in institutionalization? So we've got to keep doing those things. But I'm telling you, if we don't get stronger where the decisions are going to be made, we're actually going to see things like this, this Medicare home health payment reform that we had in 2018 that got implemented in 2020, which was supposed to just be a modernization of home care, but instead what it's amounted to is billions of dollars sucked out of the system, tens of millions of less visits being made to frail elders every year, delays in care, and more people getting referred for care that they don't actually get it. So we have to stay engaged. I would follow Washington and not get too far out in front of my skis, because if we don't fix things there or they go in a different direction, we're going to have businesses and programs that just don't succeed.
Yeah. Yeah. And Bill, I'm going to come back to you on that one. Quality is going to be a big part of this strategy for success too, and in the value demonstration equation. What investments do you think and strategies do you think the group here should be focusing on?
Yeah, I think a shortcoming in healthcare at home today is so many of these new opportunities have been embraced by people outside of this room. Hospitals going after hospital at home, the new technologies finding their way into the hands of physician-oriented groups, or for that matter, technologists along the way. And so much of what I think we've done is give those opportunities away. And what needs to be done is an investment in that innovation, starting with budgeting, not just the dollars and cents budgeting, but time budgeting and self-budgeting of just a thought process that's there. I would hazard a guess that if we were to do a test of your level of awareness in this room regarding the innovation opportunities that are there, we might not pass that test. I mean, I've had a lot of conversation with home care people from all different segments within home care who aren't aware of a number of the things that are there. But they're also coming up short on an investment in something which is ultimately, tie this to AI, okay? Which is in the data and the analytics to prove your case. I mean, you could have the biggest smile in the world and the twinkling in your eye going in and trying to say, let me work with you on this innovative approach. But you've got to have hard facts, hard data to back you up. And if you have those hard facts and hard data, when someone uses AI and raises the question, which direction should we take? What's going to come out of the chat box is going to say, care in the home.
Yeah.
So investing in those innovative opportunities, you created these opportunities, and now, I don't know if there's anybody in the room who's actually participating in hospital at home programs that are being run out of 350 different institutions? Or are they coming out of the hospital? They brought paramedics in with them instead of home care personnel to provide those kinds of services. And it's just an opportunity you don't want to waste.
I agree. And it's time to start thinking like entrepreneurs. And telling that story is really good for our own service lines, but reimagining the talents and skills that we have within our own institutions and packaging it appropriately, it is the heart of what is happening, like for a hospital at home or geri acute crisis care or behavioral health support services, caregiving and personal care services that are pre-hospice or end of life, and packaging it even for the provider groups that Steve mentioned in a way, it's not just to our health plans or to our health systems, it's packaging in a way that will help other entities. We're being told that we need to wrap up, and I'm sorry that you didn't get more intel up here, but please do approach us anytime. We love to geek out over this stuff and talk about how to strategize for the future. And think about repositioning your services, company, and economics to support it. So thank you.
Let's give it up for a nice pen.